I want to bring everyone up to date on where we are with vaccinations. As of today, we've vaccinated 321,516 of our fellow Ohioans. I want to kind of recap what our goals have been on vaccination, and they remain. We knew going into this that at least at the beginning, we would have not enough vaccine, and this has turned out to be true. We have, of course, the two companies, Moderna and Pfizer, that have been shipped into Ohio, continue to be shipped into Ohio. We hope to get a third in the not too distant future, and we hope that the production from these two will also go up. But for now, we have a scarcity. And that's something that none of us like, but that's the world that we live in. Our goals have been really threefold and remain threefold. Number one, to save lives. Number two, to vaccinate our healthcare people who are at the front line, who are fighting for us every day and who are protecting us, and we need to protect them. And third will be getting our schools back in person, still with the goal of trying to do this by March 1st. So those are the essential goals. Let me talk for a moment about the first one, which is saving lives. We're doing this in several ways. We made a decision very, very early to put a real focus on our nursing homes. This is where we have seen over half of the deaths that we have seen in Ohio from COVID. So it certainly made sense to do that. We have some good news, and the news continues to be good. 85% of the nursing homes have now been visited by the pharmacy companies pursuant to our direction. And so in 85% of these homes now, people have had the opportunity to get the vaccine, both staff and the residents. The pharmacy companies will continue to finish that additional 18%, 15% to finish it up. And we've already seen, starting last week, the beginning of the second dose and the second visits. Now, we don't have the exact numbers as far as compliance or how many people are taking those. If you remember, we said what the pharmacy companies were telling us when we took it all together was about 80% of the residents were taking it and about 40% of the staff. Pharmacy companies tell us that anecdotally that those numbers, as they go back for the second time and give people a second opportunity to take the first vaccine, those numbers have gone up. So we are happy about that. We also, based on information that we were told today, it looks like we have about a little bit over 9% of the vaccinations of people in long-term care facilities in the nation as a whole. We have a lot of nursing homes. We have over 900. And so we have a large number. But these are good results, and we're happy about that. I do have specific numbers in regard to our two veterans' homes. These are run by the state of Ohio for our veterans. One's in Georgetown and one in Sandusky. In Sandusky, they've gone back. Second visits have been made. Now 92% of the eligible veterans have been vaccinated. So we're very happy with that. 60% of the staff has been vaccinated. 60% of the staff agreed to be vaccinated. In Georgetown, again, same number, 92% of eligible veterans. However, the staff was lower there. That was 42%. So I just wanted to share that data. Saving lives, nursing homes, and those over 65. We know that 87% of our deaths have come from those who are over the age of 65. So great progress with our nursing homes. We have other congregate care facilities. And I think that we have really drilled down on not only doing our nursing homes, not only doing our assisted living, but we have some very small congregate care facilities around the state of Ohio, and we are focusing on those as well. We announced that we would prioritize those over the age of 65. We will start, as we announced, we will start next week. Those 80 years of age and older. Let me talk a little bit about that and give you some of the details and some of these things we talked about last week, but I do want to go through them again. But something new. Our hospitals have been vaccinating their medical personnel. We are telling the hospitals today that they need to finish that up. They need to finish it up by midnight on Sunday, because on Monday, they need to move then to vaccinate those older Ohioans who are 80 or older. If a hospital for some reason does not want to do that, then we will ask them we will get the vaccine back from them. But I think most of our hospitals will be in a position to make that switch and to move forward to vaccinate those who are 80 years of age or older. It's time to make that move. We want them to finish up this week. They can go into Sunday and do that, but we really need to move, and we need to move to this age group. We also, in addition to the hospitals, we have a total, counting hospitals, we have a total of about 800 providers who, beginning next week, will be making the vaccine available once they get it, making it available to those 80 years of age or older. So let me talk a little bit about how this rollout will occur. The 80 years of age and older group constitutes in Ohio about 420,000 people. As of now, it looks like we have not gotten our numbers for today, but we believe that the number of vaccines we will have for next week for that age group is about 100,000. So as you can see, this will take a while. Yesterday, the Ohio Department of Health held a webinar with Ohio's registered vaccine providers. Now, we have had, for some time, providers have been able to sign up. We have over 1,900 providers who we can pull from in the future, over 1,900. And that number certainly will go up as well as we look to other pharmacies as well. So for the first week, we have picked 800 to start this process. We've asked local health departments to partner with local emergency management agencies and the providers in their counties, and to hold press conferences or otherwise notify the media, and to do this either tomorrow or Thursday. And so what they will be telling everyone in their local area is the locations where those 80 years of age and older will be able to get the vaccine. Some of these may be walk-up clinics, others may take appointments. That will be up to each one of the providers. Now let me talk about how the rollout does occur. And a lot of this we don't control. We can designate where the vaccine is going, but the shipment, we don't control that. So the shipments will start arriving in Ohio on Monday, Tuesday, and Wednesday. And that's the way it works every week. So it will not be known until this weekend, probably on Sunday, exactly which of the providers get it on what particular date. But each provider is going to determine whether they sign people up or how they do that. So again, to recap, on Wednesday, tomorrow, or Thursday, it'll be up to the local health department. They will hold a press conference or they'll do a news release, and they will list in the county the different places and how you contact those places where they will have the vaccine. So I want to assure everybody, 65 years of age and older will remain priority. We know it's going to take a while. We have in the 1B group about 2.2 million people. So we know that will, in fact, take a while. But we want to get the vaccines as quickly and efficiently in people's arms as we can, and that will be starting next week. Also on Thursday of this week, the Ohio Department of Health will post information on our coronavirus.ohio.gov website. This is where Ohioans can see what providers are being allocated vaccinations for the next week. Residents you'll be able to search by zip code. You'll be able to search by county to find the place closest to you. The website also provides contact information for each location, each one of the providers, and links where the residents can learn more from that particular provider. Again, each provider will handle their own scheduling. Now, it's important to note that our site, the state site, will only show what providers have been allocated vaccines. It will not update in real time. So providers may go through all the vaccine they have, and that information is not available on our website, but it will be, that information, of course, will be able to come from that individual provider. So it's critical to reach out to each provider to get the latest information on the availability of their vaccine allotment and how they want you to register or sign up for that. As in the coming weeks, as more vaccinations are made available and Phase 1B opens to more Ohioans, we will be adding more providers. And this will be entirely based upon the vaccine that we get. As I said, vaccines from the manufacturer are usually delivered on Monday, Tuesday, and Wednesday for each week. We anticipate those providers that receive their vaccine on Monday, January 18th, will start distributing on Tuesday. Those that receive them on Tuesday will start distributing on Wednesday. Those who get them on Wednesday will start distributing them on Thursday. We have asked each of the providers, and they have told us that they will, to complete their vaccinations within 7 days. So they should be totally done. Some will be done in a day or 2 days, but at bare minimum, they must be done with that within that 7-day period of time. Let me again recap where we believe we are going from here. Again, we start next week, and again, it will start in some places be available on Tuesday, some on Wednesday, some on Thursday. They will kick off at different dates depending on when they get the vaccine. On the next week, on January 25th, the week of that, we anticipate vaccinations. We will open up to those 75 years of age and older. The following week, in all likelihood, will open to people 70 and older. And on February 8th, the vaccinations we hope to be available to those 65 years of age and older. When a new age range opens, that certainly does not mean that vaccinations will be completed for the previous age. We're just adding that. Again, it will take a number of weeks to distribute all the vaccines given the limited doses available. We also will move on January 25th, and we'll have more information about this in the future, available those with severe congenital, developmental, or early onset medical disorders. We will announce in the coming days how those individuals will be able to receive their vaccinations if they choose. We anticipate next week, as I said, we'll have about 100,000 doses. Again, that is for 420,000 people. So obviously everyone next week is not going to be able to get it. Our area agencies on aging have a 50-year history of providing information and coordinating services for older Ohioans and their families. While the area agencies on aging are not the ones putting the shots in the arms, they're not doing that, they're the ones to call. If you're over 65 and you have questions about the vaccines, you may have a transportation problem, they are there as they are all the time, to be of help. The Aging Network's priority is to get our seniors the vaccine, and then they'll be there as well for those who need to follow up. For more information, you can visit www.aging.ohio.gov. That's www.aging.ohio.gov, or call 1-866-243-5678. That's 1-866-243-5678.